Thank you very much, Shamila. Can I kindly ask you to stand up for a little bit? Because I know it's the last day, the energies, but we need to drag on until the end. Just stand up. And then you're going to walk around your table because the table is circular, and get back to your seat and just saying hi, speak to somebody, walk around your table to stretch a little bit. Walk around your table to stretch. Yes. Yes. Brilliant. Don't go outside, just walk around your table and come back and sit. Okay, thank you. Yes. So let's get started. So we're going to have a panel that is in presentations focusing on dignified menstruation in humanitarian settings and pandemics. And we all know that in the face of cascading shocks from humanitarian crisis and global pandemics, the existing unequal power relations as well as patriarchy continues to ensure that menstruators are disproportionately impacted. And as we know that yesterday, Bushra Mano, who presented on behalf of the Working Group on Dignified Menstruation and Climate Pandemics, reminded us with a very strong statement that menstruation does not stop because we are in times of crisis. And based on that, that is why we are having this conversation today. So I'm going to have three presenters for this conversation. And there is 𝐶𝐢𝐿 Ahodi from Benin. And 𝐶𝐢𝐿 is supposed to be joining us online. Then I would also want to invite Miss Swayamsiddha Mohanta from India to please come through. And as she's coming through, I'll be introducing Swayamsiddha. So she is a PhD scholar in population studies at the International Institute of Population Sciences in Mumbai. And she's worked as a researcher officer in the Indian Institute of Health, where she contributed to projects on nutritional security, health expenditure, youth empowerment, maternal and child health. Please give a hand for her. You can come join me on the stage. Please give a hand. Are your hands hurting? Yes! We need the energy. Thank you. And then we also have Laos. I'm looking at the surname, I'm like, I don't want to mispronounce, but from Nepal. And Laos is an IT engineer, sustainable development practitioner, and a leading advocate driving the global campaign for the digitalization of dignified menstruation. And Laos is the communication manager of the Global South Coalition for Dignified Menstruation. He specializes in digital marketing, campaigning, strategic planning, technology-driven advocacy, and is a champion for social justice to combat menstrual discrimination. So to check, is 𝐶𝐢𝐿 available now online? Is 𝐶𝐢𝐿 available? Not yet. Okay. So we will proceed with the presentations whilst we wait for 𝐶𝐢𝐿, and then our first presenter then will be Ms. Swayamsiddha Mohanta. Over to you.
Good morning, everyone. I am Swayamsiddha, so a PhD scholar from IIPS Mumbai. So today I will be presenting. So today I will be presenting this is a part of my PhD thesis. So today I will be presenting the lived experiences and evolving perceptions of menstruation among the GUND women in India, a phenomenological inquiry where we have explored how women and girls understand, experience and negotiate menstruation across the three generations, like in how adolescent experience it, how their mothers and how their elderly women or their grandmas experienced it. So as we know that menstruation is a biological event, but still let's say it's constructed or it's shaped by multiple phenomena like silence, stigmas, and deep-rooted culturally rooted beliefs, where beliefs of womanhood, purity, and pollution, mainly in tribal communities. So, and these often influence the knowledge and practices of those women. So, in India, there are many policies regarding this also, like National Menstrual Health and Hygiene Scheme and Rashtriya Kishore Swasthya Karyakram. And especially in Odisha, there is also schemes like 𝐾𝐢𝐠𝐧𝐢𝐿 scheme, where they are providing the subsidized sanitary napkins or free sanitary, they are providing also free sanitary napkins to adolescent girls, and they are spreading awareness and product access. But still the cultural beliefs that are they are continue to shape the menstrual practices mainly in rural areas and tribal setting. So my objective is to explore the lived experiences of Gond women, their cultural perception, their practices, and menstrual management of experiences among the among three generations, mainly in adolescent girls, their mothers, and elderly women in that particular community. So coming to the methodology, I have opted for a qualitative study with phenomenological research design, which collect the lived experiences of the women and girls. So I have conducted my study in Keonjhar, Odisha, with adolescent, middle mothers or middle-aged women and elderly women of the community, and I have done the analysis in the Atlas TI. We have recorded the interviews, I have transcribed and did the coding, and then I'm presenting my analysis here. So I'll be presenting the key findings. First, let's go to the thematic analysis that I have found across the interviews. So I have made the 3-4 themes on that. So what I found from the interviews across this generation was women and girls, they have experienced the menarche as menarche was experienced by them as a marker of womanhood as well as the source of restriction. One way they are believing it as a celebratory, but when it comes to the elder women or mothers, they are associating it with the secrecy and expectation to the marriageability. So and they are also saying that when we got our menarche, the marriage proposal came right through that time. The next is the impurity and restriction, where menstruation, we know that menstruation is consistently framed through the notions of impurity, right? So we're not allowed to go to kitchen, temples, or something like that. But however, some women who have seen this as an opportunity, they have described the restriction as an opportunity to rest. So I think we should learn from them that how the I will narrate there. I will give you some narration. So when one of the women said that when I get my periods, both my husband and my mother-in-law did the cooking, and my daughter brings the water. So here she is getting the familial support during menstruation through the positive, which is showing the positivity towards these restrictions. And coming to the menstrual hygiene, we know that elder people are using, they are using most of them using cloths, and it is a very prominent thing. But when it comes to the adolescent, they are shifting to the sanitary napkins, or that they are obtaining from the ASA worker, or from school and any shops. And they are also shifting towards the modern methods due to the exposure and programs that are held. However, there is challenge that they are facing is regarding the disposal. Mainly in rainy season, what they do is they are throwing their used pad, that what we call as menstrual waste. They are throwing that in river or they are burying that in river or pond, which is very which concern the which poses the environmental and health risk actually. So next will be the emotional landscape, where they also shared that they see menarche or menstruation as a pride, but at the same time they fear they fear that they will face staining or leakage, they will face the shame. And some of them also told me that they are disgusted. They feel disgusted with their own blood and their own menstrual waste. And so now coming to the generational shift, like intergenerational shift with the knowledge sources. So I came to know from their interview that elderly have a very less knowledge regarding the menstrual product, regarding their menstruation, how menstruation is occurring. When I have asked them about what you think of the menstruation, they told me one thing, that what are the dirty things you are asking us about. They are not ready to share their experiences, but it took quite a lot of time. But again, I have collected some of the data. So they have, and followed by that, mothers also shared their experiences regarding that. They have recalled that it is related to secrecy, but although there has been many menstrual rituals, they have modified these rituals for their daughters also. And coming to the adolescent, they have gained knowledge from multiple sources, like from schools, from digital media, so which help them in reducing the secrecy through, but still taboos are persist. So I think time is up, so I will move forward. Okay. So coming to the limitations, as when most of the limitation that I have found is that we do in that we find in qualitative analysis, that we don't have a large sample. We can just gather from what the respondent is saying. So this sample is my sample is very small, so it's not generalizable, and there might be some possibility of underreporting due to the sensitivity. And in my study, I haven't taken the male perspectives from the society. And coming to way forward, how we can go further is, as we know that this is a phenomenological inquiry, and menstruation is not only the health and hygiene issue. So, but it is also a cultural, emotional, and ecological concern. So, I think we have to, and we know that most of the knowledge that are transgressing from the elderly women, from their mothers to the adolescent girls. We are not originally we don't have any negative perception towards the menstruation, but with time, how our peers are framing the menstruation, how elderly or mothers are framing the menstruation, that I think we are getting influenced by their perception, and we make our perception based on that. So I think we should promote the intergenerational dialogue to dismantle these taboos, and we should then we should strengthen the menstrual health education, and mainly menstrual health education among the mothers also, and then we should go for a safe disposal of menstrual waste, and this can only be done by the frontline workers. And last, not the least, we should ensure that affordable and diverse menstrual product with the direction of use, because I found that most of the girls, they don't know how to use a napkin. So it will be better if they will get the direction on that pad. So thank you.
Thank you very much for sharing with us your hard work with the research. I understand research is not easy, but we truly appreciate your sharing with us and the key findings, including the limitations, which I think from the limitations is where we will get the information of what we can do in order for us to push the agenda on dignified menstruation. So at this point, I would like to invite Lars for your presentation. You can clap for him.
Okay, thank you so much, Nyasha, and namaste everyone. And first of all, I want to extend a huge thank you to all of you. Your participation and active involvement have made the learning conference on dignified menstruation on the occasion of 7th International Dignified Menstruation Day a truly grand success. And we are already at the last day of this conference. And I'm honored to speaking today on our 13th session on the theme of dignified menstruation in humanitarian setting and pandemics. Yeah, now I would like to share the lesson learned from Global South, GSCDM, that we conducted from various campaigns and activities. So, while we discuss the menstrual discrimination in humanitarian and pandemic setting, here I would like to share three interventions. One, systemic inequalities, two, symptomatic inequalities, and interruption of physical infrastructure. Yes, Govinda shared his stories and presented on first day how the menstrual discrimination construct unequal power relationship and patriarchy that creates the systemic inequalities. Also, our problem tree, as you see in the flex banner, and that also the menstrual discrimination is the architecture of systemic inequalities because of the systemic inequalities during entire humanitarian cycle. And population is ignored where the menstruators with or without disabilities, LGBTQIA across lifespan. And there is no or lack of menstruators in planning or policy team or decision making. And policy gaps where the problems and recognition of affected menstruators and their needs. And problem in the system of data collection where the menstruators and non-menstruators are not categorized on the basis of their needs and their disaggregated data. And lack of budget allocation and mobilization. Also, social fabric and networks. The systemic crisis interrupts the social networks which disproportionately impact the menstruators. The result of these systemic inequalities is that menstruators are left voiceless, deprived, and less or no access to essential support. While talking about the symptomatic inequalities, where the menstruators during crisis, the stereotype already exists with the response or relief team and design or distribution of relief packages because of the systematic inequalities, where lack or no menstruators and they are missing information, needs and priorities. So they are subjected to additional layer of the discrimination and violence. For example, during COVID in China, doctors and nurses used contraceptive to omit menstruation. As a result, menstruators are subjected to various forms of invisible to visible violence, for example, sexual abuses. And another intervention is interruption of physical infrastructure. Finally, the crisis itself delivers the direct blows by interruption of physical infrastructure during crisis. This leads to inaccessible service resources, such long travel, difficulty to navigate, and delayed response. It causes loss or damage of specific essential materials for mensurators like menstrual product, even vaccine in the pandemics or other crises. When those two factors, symptomatic inequalities and infrastructure interruption compounded, the most terrifying outcome is realized. Mensurators are subjected to various forms of invisible to visible violence, including sexual abuse. Now, what is dignified menstruation in humanitarian setting? It is decolonized, innovative, holistic, human right and life cycle approach that include equal power relationship where the mensurators and non-mensurators live as equal human beings in all diversities. And dismantling patriarchy, where the mensurators acknowledge that born with menstrual blood and holds the accountability to eliminate all form of discrimination and prevent sexual and gender-based violence. And inclusion, where it ensures the needs of mensurators and meet everywhere, whether in refugee camps, during pandemic, or in climate disaster. Now, the Global South Coalition for Dignified Menstruation treats the preparation and response as a cross-cutting theme for the humanitarian setting and pandemic in our campaign. We don't have a specific or dedicated project or funding, and we are conducting the campaign. As you know, we are conducting the campaign and activities in an almost volunteer-based setting. So, we incorporate that response and relief system. We incorporate the dignified menstruation framework. Awareness. GSCDM's response in humanitarian setting, for example, earthquake, COVID-19, fire and flood. Awareness raising, yes, we are conducting the awareness raising campaign on the basis of DM framework. This involves training, international and national thoughts, media and social media mobilization, and mental health program. And another is policy dialogue. We are working with stakeholders, initiating the dialogues on dignified menstruation to develop, disseminate policy briefs, articles, and reports. And we acknowledge mensurators. We push for needs assessment using disaggregated data and ensure mensurators are included in planning, policy making, and policy team. We also advocate the specific budget allocation and mobilization. And the response, GSCDM response, we are also taking as a cross-cutting theme in humanitarian setting. Pandemics covering the events like in earthquake, COVID-19, fire and flood. Here is also we acknowledged mensurators. We start with the essential steps to ensure mensurators are visible in response. We needs assessment. We must conduct it using disaggregated data, and we include mensurators in the planning and policy as well, and allocation to address the unique needs and priorities of mensurators. And another one is emotional health. We are addressing the entire campaign, addressing the trauma is paramount. We provided comprehensive emotional health support through the multiple modalities like one-to-one counseling, group counseling, play therapy. And we distribute food and non-food item as well. Alongside the emotional support, we ensure the basic needs are met through the distribution of food or non-food items. The another one is dignified menstruation kit. We distribute the dignified menstruation kit on the basis of dignified menstruation framework. We have the specific indicators to match the dignified menstruation kit. And in the dignified menstruation kit, mini handbook, which includes the question and answer on menstrual discrimination, and information sheet with menstrual products such biodegradable and reusable cloth pad and panty and other essential materials. And this comprehensive approach ensures that the specific and essential needs of menstruators are met during crisis. Dignified menstruation is a cross-cutting, humanitarian setting is a cross-cutting theme in the dignified menstruation framework. And the recent Gen Z movement in Nepal, we also take such cross-cutting theme in GSCDM response. The context for this movement is dire. We were operating amid mass trauma and violence, where the formal and informal mechanism are interrupted and menstruators are disproportionately affected. The Gen Z movement steps into the gaps. We provided the emotional health support to all youth leaders and other stakeholders, and we provided one-to-one counseling, group counseling, online counseling, and the another one is social media mobilization. While we conducting the social media campaign, we follow the authentic information and we advocate for the authentic information. And thank you so much, everyone. Dignified menstruation is not negotiable even in war, climate disaster, and pandemics. If the dignified menstruation is compromised, human rights are compromised. Thank you.
All right, thank you very much, Laos, for sharing with us the blueprint that the Global South Coalition on Dignified Menstruation actually uses in order to respond to humanitarian crises and emergencies. And I think it's one thing that we can even carry away with us as a resource as we go forward. So at this point, I would like to invite from the audiences, if you have any question or any contribution that you'd like to make towards this topic or in response to any of the two presentations in a minute, and you have a minute. And this is the mic. You can easily raise your hand if you'd like to contribute. There's another one. Okay, there's a hand right at the back. And there is one behind the camera. Was there a hand? Yes. Then right at the back.
My question is to you. Basically, I wanted to understand when you collected the data about the Gond tribal community, who are actually basically from probably Madhya Pradesh, Maharashtra, and some other parts of India. So how did you actually collect? Did you really went there, interviewed people, or what exactly is the methodology that you approached?
Okay. So, as I have mentioned that in literatures also, when first I thought of working on this menstruation, so I did a literature review first. Then I went back to my experiences, where I found that in most of the tribal communities, women are women, most of the women actually used cloth as their menstrual absorbent. But with that also they are having many stigmas on that. So therefore I thought of working on this. But mainly with tribal women is because their voices are never their voices never come out to the society. We don't know what kind of discrimination they are facing. And even what I knew, what I found in my interviews and all the, I personally also felt that I never knew that these are the discrimination, and these are the discrimination that I am experiencing. And prior to Menarche also, with most of the women, most of the girls, sorry, most of the girls don't know that this menstruation is a thing. Well, the event of menstruation, that it is occurring to a woman's body. So, well, I also thought that it would have been better if I would have like knew it before getting my period. So when coming to the GOND community, why I think this is your question, right?
Okay, so maybe to help you reframe it, the question is, how did you collect the data? Did you actually go there? Did you do interviews with the women, the girls, and their mothers? How did you do, like, collect the data?
After selecting this community, I went for a pilot study, and there I went to multiple villages. And I think it took me around 1.5 months to get these interviews, because it was very challenging, and the community is filled with multiple restrictions also. They have multiple taboos that they don't talk about menstruation. When I approached the that's why first I approached the Asha, social health activist that we so I went to her home. Then I told her about this that I'm working on this topic, and I would like to interview some of this. But before that, I want to go for a rapport building. So I wanted to talk with the women of the community. So on the first day, she was hesitant about this, that how the community will accept it. Then I think I have went for a week to her only to get this. To get the permission from her, at least to let me talk with the girls and women of the community. Then I will think about it whether I should conduct the interviews. And when I told them that we will be recording the interviews, then they are very afraid that what she will do with the interviews. They were not ready to give the interviews. And I think maybe nobody was talking about menstruation so openly. So this might have been not traumatic, but it was challenging for them to open about menstruation actually.
Great,
Does
thank
that
you.
answer your question?
Answered, right? Awesome. Thank you so much for sharing. And yes.
Thank you for the presentation. I'm Sajani. This one is for Lal. So you mentioned about acknowledging menstruators in planning policy team. So when we say menstruators, how do we define them? Do we define them as those who menstruate? What about the individuals who have passed menopause, like the earlier sessions where we talked about menopause? Can we not take account of their lived experience from menarche to menopause? Can they not contribute to the planning, the policy phase? Thank you.
Hello. Thank you so much, Sajani, for the question. And while we're talking about mensurators and non-mensurators, I would like to share our experience. We are collecting all data on the basis of mensurators and non-mensurators. We are not categorized as other as usual other organization and practiced. So while we talking about the menopause, the dignified menstruation cover the life cycle approach. So while we talking about the mensurators and non-mensurators during the crisis, we categorized menstruators and non-menstruators with their condition and need assessment. Even the pregnancy, even in the menopause state. And so we categorize their condition and their needs, and on the basis of their needs, so we also assessment the data, and we after that we conduct the other activities and distribution of reliefs and mobilization of the policy and planning team. Yeah, yes, we are practicing. Thank you.
All right, thank you. Do you feel adequately answered? Because I can see you all the way. And I don't know, for some reason, I also feel to add on to what Laus is saying, I would want to, yes, please give Radha the mic, because now this is, let's have the expert really define for us, like when we say menstruators, what do we mean? And non-menstruators, what do we mean? Thanks, Radha.
Thank you. When we call menstruators, they are the people who born with the uterus and ovaries. So if anyone like to hysterectomy, like at the age of the 26, they still considered as a menstruators, because by birth they born with the uterus and ovaries. So as Lal highlighted, dignified menstruation is a life cycle approach, womb to tomb. That is why the menopause, pre-menopause, menopause or post-menopause all falls under the category of the menstruators. This is how we define. And then while collecting the data or even in the planning phase, we all the time looking for whether the menstruators are on table of the policy making or planning. So based on that, we try to address the needs and priorities of the menstruators no matter where they are. As Santa in earlier session and Lal highlighted, the menstruators could be the 6-month fetus, or 2 days baby girl, or 12 years adolescent girl, or trans men, or menstrual disability, or with pregnancy, or with endometriosis, with perimenopausal symptom, or heavy bleeding, or cervical cancer, or even after the death. In many cultures all around the globe, menstruators discriminate even during the death rituals. So this is how we consider the menstruators through the womb to tomb. Thank you.
Thank you so much, Radha. A learning point for me as well, and I hope the clarity. Thank you. I can see the nodding. All right, so we don't want to be the panel that will go in history for being in between lunch and you. So we're going to wrap up, but before I wrap up, I'm just going to ask the two presenters to quickly answer this question in just 2 minutes, right? So that whilst we're talking about the processes and all that we can do, we would love to hear from them, from their own experiences now, to say, to guarantee menstrual dignity in crisis settings, what is the single, if you are going to be asked right now, if we had all the world leaders in the world in this space, what is one single non-negotiable policy shift you believe must be implemented in all humanitarian response efforts to promote dignified menstruation?
Okay, thank you so much, Nyasha. The solution of that question is, in one word, is dignified menstruation. If you are coming from the math background, and you can, you know the integration, we can integrate the dignified menstruation from womb to tomb or 0 to infinity. So this is the solution to address the menstrual discrimination or other discrimination in crisis and humanitarian cycle. Also, we need to integrate dignified menstruation in DRR cycle and humanitarian response cycle. So dignified menstruation is the solution for in all forms of discrimination. Thank you.
Thank you very much, Laos. Important point to say, you would advocate to ensure within the DRR cycles as well, that's disaster risk management, and also even the minimum initial service packages that is available in humanitarian settings sometimes to guide on sexual and reproductive health and rights. We have dignified menstruation included. Thank you. Yes.
I agree with his point. Okay. So when that non-negotiable policy, right? So as I belong to Odisha, where every year we suffered 2 cyclones at a year, and in Odisha there are a response that is very good. Actually, other countries are also following that. That's what I heard. So for me, it would be like making the dignified menstruation is a like institutionalizing dignified menstruation, and on instant basis, I think it would be better if we will provide them with the menstrual kit in the emergency situation. And along with I want to use one term that menstrual friendly toilets should be provided, not like where we can access the menstrual product, we can have the privacy for all the menstruators, not only the women and girls, because during the crisis, it doesn't only affect the women, it affects all the menstruators. That's all I have to say. Yes.
Thank you so much. Again, emphasizing on saying we need to institutionalize dignified menstruation in the DRR responses for humanitarian crisis. All right, so thank you so much. And I think from this session, what we are walking away is that centering dignified menstruation is indeed a non-negotiable step when we are ensuring the needs, the rights, and the dignity of all menstruators. And this needs to be there before, during, and even after a crisis, so that we are creating that conducive, equitable environment for everybody. And what I'm also concluding from this conversation is that if we're going to be talking about upholding menstrual dignity in times of crisis, it means we go back to recognizing this is, again, a human right, and it requires us to come through together to dismantle the patriarchal norms, to remove the shame, ensure that every menstruator can navigate that time of crisis and their menstruation with respect, privacy, and them being able to participate in their everyday life. With that, thank you very much for paying attention, and we can give a hand to the panel.